I get a phone call that says our building is on fire. It's freezing cold. They have no belongings except what they're wearing. No coats. I mean, it was a real fire. I am so proud that this team has stood side by side and weathered all of the challenges. They suit up, show up, and they're prepared to adjust and adapt at a moment's notice.
Rural communities, specifically in the state of Nevada, are underserved. Transportation is an issue, money is an issue, housing is an issue. And some of those services that we made an effort to provide but didn't have the resources to do it were things like psychiatry, targeted case management, peer recovery support services, basic skills training, psychosocial rehabilitation.
Becoming a certified community behavioral health clinic opened up the doors for us to become a one-stop shop.
We're not just the drug and alcohol place. We are mental health, we are psychiatric, we are women's services, we are, peers and case management. Anything that you could think of in a behavioral health world, we can now provide it.
We get phone calls from law enforcement, from social services, from medical providers, from parents, from probation officers. It saves a lot of dollars, it saves a lot of time, but most importantly, it saves lives in a sense that the clients that we serve aren't, being punished, if you will, for having a mental health condition.
I have 3 sons, and James is my middle son. He had ingested several hundred pills and drank a lot of booze. I know firsthand the importance of crisis intervention. It saved my son's life.
When someone's at that point, when they're in crisis, that's an opportunity to talk to them and to just really meet them where they're at. And that's why I love, this mobile crisis, is because we get to go into their space. We don't want suicide to be on the table as an option for families and for other generations in those homes. And so I think just the fact that that news is spreading has been important.
A CCBHC over regular treatment model is going to mean relationships, and people don't quit on relationships. They quit on things that don't work.
With CCBHC, we could go even farther. We could get these women the extra help that they needed and, stay in contact with them for 3 years. Like, that doesn't happen very often.
When I first came to New Frontier, I was getting clean from drugs and alcohol. I didn't have a stable place to go back home to, and so I went back into my addiction.
To me, she was a small girl that just needed some support, needed some confidence. So many people broke her down in life.
Helped me to learn how to love myself again and be more confident in what I wanted to do in life and to give me the right tools and guide me in my life.
I was in a really bad domestic violence relationship. It was my rock bottom.
It was very, very rocky. It was touch and go. Sometimes I'd hear from her and then she'd disappear for a bit.
I had zero hope whenever I first walked in. I'm gonna be honest. I was just, there was no way to save me.
You spend 10 minutes with Heather and you're like, I love this girl and I want her to succeed. And seeing her with her children, it was...
They set me up with extra counselors, anything that I needed, anything that I asked for, and they helped guide me on my entire journey.
And that's why, you see Heather and Mia respond the way they respond when they see us, because we spent extra time with them, just getting to know them on a personal, it was human to human interaction instead of everything being so clinical.
And that's what the CCBHC did for us. It helped us make it happen.
I think it's an absolutely amazing model of delivering behavioral health.